Okay, so I'm Al Gurovich. I'm the editor-in-chief of the Cardiopulmonary PT Journal, and I'm extremely happy and pleased and honored to present Dr. Suh-Jen Lin and Dr. Mike Shoemaker that they agree on doing our first presentation of a series of presentations that the journal is trying to bring forward to increase the number of applications or the number of submissions and the quality of the submissions and the success rate of young clinicians, young faculty when they are presenting their manuscript to the CPTJ. The editorial board have this conversation like 6 months ago. We decided to do a series. This is the first one. We absolutely think that case studies are extremely important for our journal and that the clinician, especially those that are doing the residency program in cardiopulmonary PT, they have the opportunity in our journal to present your finest work that we want to know. So that's the idea of this session today. As Dr. Shoemaker was just saying, as soon as we have the recording, this is going to be available on the YouTube channel of the CPTJ. So probably early next week is going to be available. And the idea is that we can make it viral because the more people have access to this information, we think that we're moving the needle for research and clinical research in the cardiopulmonary academy. So thank you for being here. Thank you again, Dr. Shoemaker and Dr. Lin, for doing this effort. And I have no doubt that this is going to be a great presentation and that you're going to feel like you are better positioned to submit your work to CPTJ. So have fun, ask all the questions you need to ask. And Mike, Suh-Jen, please take it over.
Thank you.
Thanks, Dr. Gurovich. Welcome, everybody. Thanks for joining us tonight. I want to keep it pretty laid back, so feel free to, stop us, interject, ask questions. If there's dialogue afterwards that people want to have about case report ideas, we certainly can get into that too. So just want to, keep it as informal as you all want it to be. I'm Mike Shoemaker. I'm a professor at Grand Valley State University in Grand Rapids, Michigan, and a practicing therapist at Corewell Health West Butterworth campus in the cardiothoracic ICU. And Dr. Lin, I'll let you introduce yourself.
Oh, hi. I teach at Texas Woman University Physical Therapy in Dallas. And I have been with TW for more than 20 years. Thank you.
And Suh-Jen and I are both associate editors with the Cardiopulmonary PT Journal and have been for quite a while. And thought that we would walk through a variety of topics related to developing and submitting case reports. So I think a good first place to start is just to show you the resources on the website for potential authors. And so let me get the right screen here. And if you go to the CPTJ website and you go to for authors, click on information for authors, it'll bring you to this page, and you click on instructions and guidelines, and then that will open a new page, and you just need to scroll down to the section regarding preparation of a case report. And this provides you an outline of some of the key things to be thinking about when you're preparing your case report. Couple things to note: the word limit, 1,500 words is pretty tight, and so you have to be pretty efficient in the way you communicate. There might be times where you didn't provide as much detail on something because of that word limit. And during the review process, if the reviewers or the associate editor, wants you to expand on an area, then we'll certainly ask you to do that. And so, as you look at some of the case reports that we'll look at tonight, some of those are definitely beyond 1,500 words, and that really comes about as part of the revision process. and things like that. Also notice 3 tables and figures. Again, I think there can be exceptions to that when requested by the reviewers or the associate editor in the review process, as well as a reference limit. Couple of other things, and we'll note this in a different checklist as well. But one thing to just be thinking about is the patient confidentiality piece, the release of information, or whatever your institution's protocol is for case reports. Just make sure that you follow that and you're ready to answer any additional questions that may come about in the review process about whether or not you followed your facility's protocol or procedures, or that you definitely sought and obtained the patient's consent to use them as a case report. And I don't think we need to go through each of the different sections of that case report here, but again, that information is nicely outlined. The other thing that we wanted to share as part of your case report submission is that you'll need to support the relevant equator checklist. And so the Equator Network has a variety of checklists depending on the type of manuscript that's being submitted that represents best practices with respect to the content that is included. And so there is a checklist on the Equator Network that relates to case reports, and that's required to be part of your submission. And this is really a handy checklist. Those of you who've maybe submitted manuscripts before of different types, and you're looking at the relevant Equator checklist, sometimes some of the requirements on some of those checklists are a little bit obscure, but this one is really helpful, and we'll make this readily available to you. Dr. Lin's going to be putting together a Google Drive with a couple of resources that we're using tonight, so you guys have easy access to that. But this really works well as a outline for what content should be included in your case report. And we're going to hit upon a number of these as we talk about some of the common errors and some key suggestions that we would have for potential authors of case reports. Yeah, so I don't know that we want to necessarily go through each of these, but again, other than to call out, this is a really useful checklist and useful in developing your case report. Dr. Lin, did you have anything to add at this point?
No, I'm trying to create a folder. Later, I can share this folder with everyone.
Great. And then, did I not? That's nice. I do this a lot. I didn't even share the relevant window. See, this is where this needs to be interactive, and you guys need to stop me and say, hey, what are you talking about? What are you looking at? So here is the CARE checklist that you find on the Equator website, and has a great outline of all the different content that you would want to include as you develop that case report. So I'll just kind of scroll through that a little bit. All right. And I might actually even keep this up while we talk about common errors, because I think we'll be able to highlight where those are on this checklist. So I think maybe first and foremost, as we talk about common errors, one is just not having a focused purpose, or not succinctly or coherently expressing your purpose of the case report that you are thinking about writing. And so, a couple of examples that we might look at here, and we just kind of went through and grabbed some of the case reports from the last couple of years that have been published in the journal. But it's good to have a very clear purpose. The purpose here is to review the pathophysiology of acute cardiovascular dysfunction after spinal cord injury, and translate it to clinical management, right? So very focused purpose. And that's going to be the conclusion of the introduction. It's going to be the conclusion of the lit review that demonstrates that we need this. We needed an article that fulfilled this purpose. And then that purpose statement is going to then also direct your discussion later on after you present the case and what was done and what the outcomes were, because it'll help you then come back and refocus on what your purpose is. I think the second and somewhat related to this, and you'll see that here on the checklist, which is with regard to the literature review. And so you'll see that as this item here, trying to highlight why is this, not only is this case that you're looking at unique, but why is this case needed to address a gap in the literature? So again, if we kind of go back and look at this one, there's not randomized controlled trials about managing patients with cardiovascular compromise with spinal cord injury, right? And that's usually where the case report comes into play. Is the case report is a unique patient with a condition where there's literature that has to do with different angles of that patient, but no literature or previous study pulls it all together and articulates or highlights the physical therapist clinical decision-making or the physical therapy intervention for that unique type of patient. Another example, importance of physical therapy interventions for medically complex patient with severe COVID-19. This was published in 2022. And the publication cycle is usually slow. So this case report came pretty early on. And again, there just wasn't anything out there. And so as you look at their literature review, certainly given the timing of this, a detailed literature review about COVID-19 and some of the main issues that take place within COVID-19. What do we know about physical therapist management of patients with COVID-19? And what are some of the considerations and the decision making? Again, no randomized trials on physical therapy management of patients with COVID-19. Here's another one, clinical reasoning and collaboration for functional mobility and ambulation under multiple conditions of concurrent central ventricular assist devices, right? So there's just, there is literature out there about exercise training in patients with durable LVADs, who are, typically months or more post LVAD implantation. But there's just not randomized controlled trials of the physical therapist management of patients with central support in the ICU setting. So again, just I think one of the most important things to figure out, how are you going to frame the case report, the gap that you're filling, and why your case is unique, for example. Dr. Lin, feel free to jump in anytime if you've got additional thoughts.
I think because all of you kind of are clinical specialists, or maybe you are in a resident program, you all need to write a case report. But where you are thinking about a topic, important thing about it, maybe it's a unique surgery, a unique outcome you use, or unique approach you use, anything new. So put that in mind while you are treating patient. If something new came up, then you think, hey, this probably is a case. I will write a case report and then start planning what kind of outcome you would capture, and then you will continue to assess throughout your treatment. Maybe it's a week, maybe 2 weeks or 3 weeks. I think just being alert. Oh yeah, this maybe is a good topic for me to write up. And there's something unique about the case. Maybe it's the surgery, maybe it's your treatment, or maybe it's specific outcome you use. Yeah.
Yeah,
Thank you.
and it doesn't have to be, you know, if you look at the medical literature, right? Case reports in medicine are like the super rare conditions. And these don't have to be rare conditions. They have to be just not studied combination of circumstances, I think is a way to think of that, right? Like research about physical therapist management of heart failure, nothing novel there. But maybe it's acute heart failure in a patient with comorbid, you know, X, Y, or Z receiving, you know, whatever kind of medical or surgical intervention where there isn't research on that. And so it's not about the unique or it's not about the rare condition. It's about the unique combination of circumstances as they apply to physical therapist practice, if maybe that's helpful. Another common error is insufficient objective measurement. And I think this is, you know, as we work with students in DPT programs with who are doing case reports, you know, the difficulty is not having enough outcomes, enough objective data to demonstrate the outcome of the patient. And the difficulty with that is it takes a lot of foresight up front to get an adequate amount of baseline measurement. And I would say it doesn't have to be on day one. And if you didn't get everything on day one, like it's all over and it's not going to be a good case report. But definitely the sooner that you can get those outcome measures, the better. And again, you know, hopefully in the context of a residency, you know, you're really being very intentional about your initial examination. Hopefully you don't have a lot of sort of bad habit patterns and complacency and just sort of, you know, quickly cruising through an eval and not collecting data that you otherwise might, you know, if you knew this was going to be your case report. So in a way, it might be helpful to sort of just get in the habit of, you know, over maybe the next, you know, couple weeks as you're seeing patients, you're just thinking like, huh, if this one were the case report, what measures would I use? And I think that's going to be helpful to you, not only if it ends up being a patient who you're going to write a case report about, but I think it's going to help you be more thorough and more complete in your initial examination of the patients that you were seeing. So, but yeah, definitely having insufficient objective measurement, either at the beginning or the end, and certainly it's really most ideal to have both beginning and end so you can demonstrate that change because that really is your data that you're presenting about that case.
If in terms of any kind of topic, maybe I can give an example. Like recently, say physical activity in patient acute care or in ICU. Actually, that's a big topic there. Maybe you can say, hey, this population that I'm treating now, I haven't read any article about their physical activity. Maybe you can just give your patient a pedometer. Just say, hey, initially it's only like maybe 500 days a day, 500 step a day, and you just track throughout this your treatment session. That outcome it will be very unique for this diagnosis or this kind of patient. We have been seeing treating every day, but we don't record their step count or daily count, a daily step count, right? Then just, hey, let me measure it. Then you report it. So I think it will be, if you're going to combine section meeting, you listen to any lecture, anything. Yeah, you heard any kind of unique outcome measure. Maybe, hey, let me try to measure this one in my patient and then report it. Then that will be a new topic. So just on the big topic of physical activity, this area, there are many we can do, but maybe there are other topics, but I just throw out a potential topic you can think about.
Yeah. And And just to sort of highlight here too, you know, on this care checklist here, where the measures come into play here in terms of your examination findings and your baseline data on which you're going to be able to measure your outcomes, and then of course reporting those outcomes here and having a good baseline is definitely helpful. I think another common error is just simply straight up writing quality. And you know, we recognize that for a lot of folks submitting case reports, you know, they're not individuals who have a lot of previous writing experience and a lot of publications and things like that. And so, you know, it definitely is an acquired skill and it takes a lot of reps. But I think just using as many people as you can to read through your manuscript and to, you know, first and foremost, just catch all the basic grammatical stuff, but also reading it with an eye towards clarity. Are you really communicating effectively and efficiently what you're trying to communicate? Again, especially with a word limit, you really do have to be pretty efficient in how you express and talk about the information that you're trying to share in that case report. So again, not having a focused purpose, not having a good enough lit review. And it doesn't have to be a super long or extensive lit review. It just has to be demonstrating the gap that's being filled by that case report. Not having sufficient objective measurement at baseline and at outcome, and then poor writing quality. So I'd say those are by far the four most common errors. And if you can address those, you're already going to be, I think, really well set up for success for a case report. I might just pause there for questions from the group. You don't have your videos on. We can't read your faces. You could be asleep. You could be on a treadmill. You could be walking your dog.
I put a Google folder link, share how do I say, share link to a Google folder. So in that folder, then everyone can access that care checklist and all the example of case report that Dr. Shoemaker was kind of talking about. So yeah, so I post that link there. Michael, maybe you can see whether you can click and access that one.
Yep. Yeah. Jeanette, go ahead.
Quick question. So I'm not a resident or a clinician, actually. I'm an academician. So I have a quick question because I would be writing more of an academic case report. And so not a clinical case report. And the care checklist that you showed is mainly clinician focused. Is there something similar to that is more academic case report focused?
So what do you mean academic case report? What's your title?
So for example, like I have done cardiopulmonary related like simulation case reports with my students. So it would be my case would be a cohort case. A cohort of students. So it's not a clinic, it's not a case, a clinical case.
Yeah.
So your case report kind of thing.
So I don't think there's a checklist for that type of case report. One of the examples that we have here is this one. So this one is sort of a case study, but it's not a patient case wait, what was this one? No, this one was it. Where did it go? I know there was another one, but it was more of an administrative case report.
Because I typically use the case report book that the APTA published years ago to base my academic case reports. but I hadn't seen a checklist like you had shown, and I wasn't sure if there was something similar that the journal recommended for that type of case report.
Yeah, I don't think there is.
Okay.
This might be one that's good to look at. A case report of physical therapy perspectives from the front line,
Okay.
where it's much more of an administrative type of case report. I think, you'd still be required to submit the care checklist. And then I think you would just put NA where it wasn't applicable. And then where it could be sort of stretched or translated or crosswalked to the administrative case report, then just reference, the page number on which that took place. But otherwise, I think you'd put NA and, the reviewers and the associate editor will be able to, know what you're doing there. So
you'd still submit the care checklist with it.
Yes, and then just
Okay.
put NA because part of the system is going to, require that be submitted before it can really move through. So you have to have something there anyway.
Got it. Okay. Thank you.
Yep. Any other questions?
This is Stephanie. I don't have a question, but I think for any students or residents on the meeting, having guided a few residents through the aspect of writing a case study, I think really the most helpful, and this is maybe not to point fingers at anybody in academia, but I think we're all dissuaded from, putting value on a case study in school because, we learn obviously that they're not very applicable to the general population and they're kind of low quality evidence, yada, yada. But I think really the best way to feel confident in writing a case study is to read a lot of them. So having not many experience, maybe if you find yourself saying, oh, I need to write one for my CCS application or for residency, or just because I have a really interesting patient, look over a lot of case studies and just really, I think, highlight the aspects that Mike has mentioned already of the uniqueness and kind of the outcomes that are investigated. I think that's a stumbling block that a lot of my former residents have had of just being very rudimentary in their description and not being really familiar with how to set one up. And so I think just, go ahead and spend the time reading the research, even though, again, I don't think we're kind of, oh, it's not good quality evidence. Like if it applies to your specific patient, it absolutely is. So I think just get yourself familiar with them and that will really help you set up your own structure when you're writing one yourself.
Yeah, and thank you, Stephanie. And yes, Suh-Jen and I are here to apologize on behalf of all academia for ever giving that impression. Because yeah, it really is an important form of research, and that's really why we're trying to to do this webinar and get the word out that case reports are valuable and valuable descriptions of physical therapist practice. And that's maybe the mind shift, is not to say, oh, I'm producing evidence on how people should manage the patient. But I think if you come from the mindset of I'm adding to the literature a description of physical therapist practice, kind of taking on a more ambassadorial. Oh man, unfortunately, this is recorded. I might edit that out. But you're being an ambassador of the profession, right? By articulating for the world really the complexity of physical therapist management of some of these patients, and particularly as it pertains to those with cardiovascular and pulmonary dysfunction. So, any other questions on common errors? Okay. We wanted to talk a little bit about suggestions for improving organization. So first and foremost, I think invaluable in a case report is tables and figures. So how do you succinctly tell the story? So first, with regard to a timeline, especially if you follow the patient across the continuum of care, or there were a whole bunch of events that took place, medical or surgical events that took place, a visual timeline is worth 1,000 words. And when you got 1,500 words, that means, You've already used 1,000 of your 1,500. No. But yeah, so a visual of the timeline, whether it be a table or a figure, doesn't matter, just as long as it helps sort of, help the reader just look and be like, oh, okay, I see what they're talking about. Certainly to describe the interventions, tables are very helpful to outline those. And you can also be creative too, right? In combining the timeline and the intervention. Like, I mean, I guess I would hope that you aren't delivering the exact same intervention at the exact same dose across an entire episode of care. We typically are progressing our interventions. We're trialing different interventions. And if that's relevant to the story that you're telling for that patient case, you can intertwine the timeline and the interventions to demonstrate progression or to demonstrate response to changing clinical context, medical stability, whatever that might be. It's really helpful to just put that there, because to try to read that in a paragraph is difficult. And it's also a great way to save words. With that strict word count, good effective use of a table can really help you save on that word count while also just making it easier for the reader. Yeah, Suh-Jen, any other thoughts on that while I try to find a couple examples to show here?
Yeah, I think a chart can be worth 1,000 words, right? A chart, a figure. So because you only have one case, so instead of saying pre and post, say, let me use physical activity example. If you are seeing patient for 3 weeks, you're monitoring physical activity. If you only show day 1 and then day 20, then you don't really we don't really know what's going on in between. So if you're able to see a dot, right? Okay, first day the steps say 200 steps, the second day, then we see the trend over the 3 weeks. And that's really meaningful. That's really powerful data. So when you are treating patients, just be mindful of collecting objective data, meaningful data. And whether you're seeing them 2 weeks, a week, even a week, 7 days of data is meaningful, is very meaningful. Although we say, hey, case report, that's low quality, right, compared to RCT anything. But any new finding coming from a case, right? So we are seeing many patients, they are pretty unique. Let's just try to report it. But we just need to have enough data to show this patient's progress.
Yeah, and in this example here, table 1, this is from the again the concurrent centromag ventricular support. But you'll notice that this has both timeline elements with regard to their hospital day, with regard to the PT session. By looking at this, you can also get a sense for frequency, right? They had 7 visits in the first 12 days. And they had 13 visits over 27 days. So there's a lot of timeline information there. It shows the progress of measurements. And, a lot of us are probably writing case reports on inpatients, right? So I think a lot of facilities are using a variety of mobility and activity measures that are scored daily. So you can sort of have that and track progress that way. You could sort of zoom out just a little bit on some of your interventions, and you don't have to be super specific, right? Maybe you did bed mobility interventions. You maybe did that 3 or 4 different ways, but it just made sense to sort of log like, hey, bed mobility was a part of that session and edge of bed activity. So it helps the readers see like, oh, what does that session look like? So tables and figures, really make sure that you use those to your advantage, both from a word count standpoint, but also for telling the story. I think another thing to think about is trying to make your case engaging. What's going to draw the reader to want to read anything beyond your abstract? It might be that you're describing and talking about a condition or a pathophysiology that they don't know a lot about, right? So you want to have enough in that introduction or the discussion that gets the reader on board. If you're like, oh, I don't really know much about, right ventricular dysfunction in this type of patient and how it's managed, give them a morsel so they walk away having a better understanding of the role of pulmonary artery vasodilators and unloading the right ventricle or something. Try to think about like the reader who's just one step behind where you are as a clinician, and how do you bring them up to to where you are. Linking or articulating decision making. And again, this is where you're the ambassador of the profession and demonstrating the decision making that the physical therapist makes in whether or not to mobilize, whether or not to progress, whether or not to regress, whether or not to terminate, whether or not to refer and consult. Try to find in your case report those couple of key decision points that required the skill and judgment of the physical therapist, not just the physical therapist, but the cardiovascular and pulmonary physical therapist. And I think if you can kind of find that and articulate that in writing, that I think makes a case report that much more engaging. And then just anything else besides those two things that you think a reader would be like, huh, now that I read that case report, I'm going to look at a similar patient a little bit differently, right? I remember reading the case report about X, and they did these things in their treatment session. Maybe that gives me now some new ideas, and helps me sort of move past a rut. So as you're sort of evaluating whether or not to use a patient as a case, or if you've decided you're going to use it and write that patient up, try to find those, I think, morsels that make it that much more engaging and worthwhile of a contribution to the literature, beyond just filling a gap in the research, but really, how are you going to make the PTs who read this just a little bit better? I think that's a good mindset to have. Pause there for questions or comments or stories.
Hi, this is Ashley. I'm actually a current cardiopulm resident, working on a case report right now.
Awesome.
And the patient actually just got discharged, but he was at the hospital for over 200 days. So I know it's a long one. So I'm having a little bit of trouble, I think, condensing the information, considering there were so many outcome measures performed at so many different points and so many PT interventions, a lot of medical changes. I'm just wondering if maybe you knew of like a case report that maybe had a long-standing patient and they condensed it really well, made it a little more digestible. I feel like I'm just like, it's too much information I'm putting in it.
Yeah. So I don't want to have one. Well, I'd have to look through the examples that we're going to post as to the duration of some of these.
Oh yeah, I haven't checked those out yet. I apologize.
And they may not cover it, but I guess so I would offer a couple of things. One would be, again, thinking about the point of the case report. Is there a period in time that's worth a zoom in on the timeline, right? So you might have, you could sort of start with your whole timeline. Maybe you even have a graph that charts the AMPAC and the Johns Hopkins scores like over the entire whatever, and you have key arrows of key medical events that sort of show like, hey, they progressed and then they regressed, but then they came back up here. Maybe part of what you're trying to do is the big picture. Or maybe what you're trying to do is highlight the physical therapist intervention or decision making after each major medical event. Maybe there's one event. So I think you just have to decide, like, are you trying to do the whole thing, or is there a smaller sort of sub story where you could just summarize the bigger picture context and then really zoom in on what you're trying to tell. But yeah, trying to do too much and trying to be unfocused can get difficult to have a nice, succinct, and coherent manuscript.
Okay. So you think like maybe a table with the major events medical wise would be okay, and then also have one with like PT interventions. So I don't want too many tables, but I feel like if I were to write it all out for one of them, it would just be too much.
Yes. Yeah. And maybe, again, maybe even zoomed in, because maybe there's a critical period
Yeah.
where, the patient went through a whole bunch of things in the first 150 days, and you just summarize that very briefly. And now you're
Okay.
zooming in on days 150 to 200, where you think maybe it made the greatest difference, or it highlights the decision making you're trying to highlight, or it highlights, the patient's response to intervention, or whatever. So,
Okay, cool. Thank you. I appreciate it.
yeah. And then I think too, like, reach out, you can reach out to myself, you can reach out to Suh-Jen. I think we'd be happy to just kind of take a look and give you some direction. If you're kind of like, well, here's the whole thing, help me figure out where to refocus. Like, I think we're happy to do that. So,
Okay, great. Thank you. I appreciate it.
yeah. Any other questions? One additional thought, like where you're interpreting the amount of change that took place, right, for a given outcome. I think we're all pretty good about this, but just keeping in mind, like, is there a minimum detectable change or a minimum clinically important difference threshold for the measures that you used, and interpreting the patient's change through that lens, I think is certainly helpful. Yeah, I think anything else that we haven't mentioned, Dr. Lin?
Yeah, I think, yeah, you covered pretty well, but I think just important for the data or the outcome measure. You don't need to have several measure, but focus on one or two, and then you really show serious changes of that specific outcome.
Yeah, and again, so a great example of, you might even have a bunch of measures, but focus on the ones that are central to the case, to the story that you're trying to tell. Because it gets really difficult if you don't have a measure that relates to the story that you're trying to tell. If you're trying to demonstrate the focus of your exercise interventions to improve that patient's functional activity tolerance, but all you have is AMPAC 6 clicks measures, like, well, that's going to be a tough case report because you don't have data to sort of support that. So, and then if you did have something like serial 6-minute walk tests or some other measure of their functional activity tolerance, then you might report the 6 clicks AMPAC potentially, if you can kind of get that in there briefly without using up too much space. So it provides context, but you don't need to spend a whole bunch of time and effort talking about that if it's not part of your focused purpose. Yeah, so that's a great point. Anything else? Any other questions? Any other stories? Any networking anybody wants to do while we're here? This is a collection of cool people.
Basic case report, just a story, right? A story. And so I think just during your clinical everyday work, just keep being curious to see what's new about your case. You're treating patient every day, right? And every patient, maybe their diagnosis is similar, but there's something different, right? So think about those differences. Anything you do differently, I don't know. I still don't know how to describe it, but I think because many patients to us, even though they have the same diagnosis, but they are different, right? So think about just try to come up a special outcome and measure it. Yeah, maybe that's the one I would recommend your approach. Try to find any evidence-based specific outcome, but clinically people not using it. Then you apply it. Then that would be new, right?
Yeah,
So
and Stephanie, I appreciate your comment there. Even a negative outcome, in fact, you know, there's publication bias is a thing, right? We only want to publish studies that show a positive outcome. And when it comes to case reports, we feel like, man, you know, we want to only publish those who have great outcomes. Bad outcomes probably, frankly, are going to be more valuable. Some of you know me, and you know that I'm a pilot and a flight instructor, and aviation is sort of the other part of my whole world. But the aviation world is you can't read a single aviation periodical without an accident report, some sort of mishap, whether it be fatal or not fatal. Because that's how pilots learn. They learn from the mistakes of others. And I get it in the medical world. There's other issues related to liability and those sorts of things. But having as many opportunities to report when things don't go as well, and why that might have happened. I think there's a lot of value in that if you have the courage to, pull a case out of a skeleton out of your closet, that's going to be valuable for everybody to learn from. So yeah, great point, Steph. Anything else? All right. Well, you guys have the link there to those resources. We'll make that link available on some of the other Academy, like on the Academy website and stuff, so you can also get there that way. And again, feel free to, I think, reach out to us with questions. Our whole goal here is to make CPTJ a more friendly and encouraging place to submit case report manuscripts, and if that means having an opportunity to coach you a little bit before submitting, that just makes the process that much easier, that much cleaner, and allows for a more supportive learning environment for this. And so that goes to the students, it goes to the residents, it goes to the residency faculty, who are mentoring these case reports. So use this as a resource, and we look forward to your case reports. So thank you all for joining. Have a great night, and we'll see you later.
thank you.